Hey guys, welcome back. I wanted to talk a little bit today about some different support people that you may want to consider or might need to consider throughout your athletic careers. So, a lot of people ask us, what is a physical therapist compared to a chiropractor, and what does that do versus a massage therapist? So, I wanted to just review a couple of different professionals that you might interact with over your sports careers. So, for example, I'll start with a physical therapist, which is what I am. A physical therapist treats any movement dysfunction. We'll just say that. Like, if someone is dizzy, had a concussion, has a neck pain, headache, just can't move around, they can't even get up from their bed, if they have pain, they have a torn muscle, a tendonitis, a sprain, any sort of aches or pains, physical therapists treat all of those things. Those are called musculoskeletal injuries when we're talking about our muscle and our joints and our tendons and other soft tissue. And when we talk about, even physical therapists will treat like kids, which is called pediatrics, and that's a specialty area where kids who have some developmental delays or some other injuries from birth, different difficulty with coordination or motor control. There are specialists in geriatrics, which are older people. There are specialists in neurological physical therapy. So someone had a stroke, which means that their brain lost some oxygen for a while due to either a clot or a bleed, or Parkinson's disease, which is another neurological problem, meaning it affects the nerves or the brain or the spinal column. So that's more of a neurological specialty. So physical therapists will treat all of those things with different movement techniques, whether it be our hands working with the person to get their soft tissues to heal, doing different modalities, specific exercises to recruit better motor coordination, and just teaching a person how to progress even post-operative. So say somebody had an ACL repair or rotator cuff repair, and they need to be coached through what level to protect that area and how to gradually get back to their activities. So that's kind of it in a nutshell in terms of physical therapy. There's so much that we do that it's very hard to just explain in 2 minutes everything that we do. So then some people go, well, why would I see a physical therapist rather than a chiropractor or a massage therapist? So that question is not very clear, because chiropractors will often do very similar manual therapy techniques that they would call an adjustment of the spine or an adjustment of the joint. But newer or younger, more modern chiropractors don't just manipulate the spine anymore, but they will do some soft tissue work. And so we'll say they are specialists in the techniques associated with chiropractic, which their theory or approach might be different from what we're doing in physical therapy, but ultimately trying to get you to the same point. So then massage therapists are a practitioner that has typically about a 1-year degree in massage therapy training, meaning they only work on massage and working with soft tissue. And so when we just have some aches or pains or some muscle soreness, massage can be very helpful with cleaning up all of those areas of tightness or difficulty recovering in our muscles, but not necessarily adding any of the stretching or higher level manipulation, mobilization, muscle recruitment that you would find from a physical therapist. So it's a good tool for some muscle recovery, we'll just say that. an athletic trainer. So, what's an athletic trainer? Typically, an athletic trainer is someone who has a degree, either a bachelor's degree or a master's degree, and they will typically have experience and knowledge in on the field emergency medicine. So, dealing with and working with sports related or athletic injuries specifically and managing them very acutely. So they may work on a little bit of training to get you back to work to sports, but not necessarily to the high level of when we're in physical therapy, not as involved, I would say. So we'll just say when it's sports related and it's an acute injury, that's when they're going to be getting involved. So then we have medical doctors. So medical doctors are, again, doctors of medicine. So just kind of backing up again. So a physical therapist is typically a doctor of physical therapy. A chiropractor has a clinical doctorate in chiropractic. Massage therapists have a certification or a license. An athletic trainer has a certification or a license and typically has a bachelor's or a master's degree. And medical doctor and doctor of osteopathic medicine will have a medical degree as well. So why would you see a medical doctor or a doctor of osteopathic medicine or a DO? Typically, when you say have a concussion and you need clearance back to work, school, or sports, you will need to be involved with the medical doctor. The physical therapist might treat you for the concussion, but the medical doctor will do the final say in all of those things. They also do need to sign off on your sports physicals. But other than that, unless it's a sports medicine physician or an orthopedic surgeon, we don't necessarily need to go to a medical doctor as the first line of defense if we think we have an injury. So my point in this video is that I want you to understand that if you do have an injury, go to your athletic trainer and your physical therapist first. Also, your chiropractors can help you with that. You can get cleared back to sports by those individuals. You don't necessarily need to see a medical doctor in order to get cleared for that. You don't need x-rays or MRIs in order to test to see if the injury is something that's severe enough that you would need to have any additional diagnostic tests. The physical therapists, athletic trainers can test you on specific things to see if an injury is bad enough that they need to hold you out of sports or that you need some specific physical therapy or rehabilitation to get back to sports. So I hope that answers some questions in terms of what to do first. But ultimately, if you have an injury, ask your physical therapist. I'm a little biased with that. Get a consult. Those are oftentimes free. Hey, is this bad enough that I need to do therapy, or can I just go and play and not worry about it? So feel free to ask me some questions. Again, Jennifer Jeske, Doctor of Physical Therapy with Optimal Physical Therapy, and looking forward to working with you if you need anything, but hopefully not, right? Because you guys are going to stay healthy with all of these injury prevention items that we're working on. Hey, have a good one.